Yeah, the process, once you're convinced that you're ready to get into treatment, is really quite simple. Pretty much Monday through Friday, about 6:30 in the morning till around 11, we can offer treatment on demand. You can come in, don't be under the influence. Ideally, you would be in withdrawal, usually early in withdrawal. Maybe at the time you'd be inclined to try to take whatever you're abusing that is an opiate, and you'll meet with our nurse practitioner, who will do take a medical history and perform a physical exam. They'll talk with you as the patient as to which of the medications you would most like to start with. Talk with the doctor, and an opening initial dose would then be decided upon. You'd be taken to the dispensing area, and your medication would be given. After your first dose of the medication, which on the first day is usually your half dose, you'll be getting a second half, about an hour or so after the first dose. So between, you'll be meeting with your intake counselor, which may or may not be your long-term counselor, but you'd get a feel for what the counseling staff is like, and maybe some of what the initial paperwork that needs to be taken care of for the first intake, how that goes. Thereafter, you would be assigned a counselor that would be your long-term counselor, and you would meet on a as-needed basis during the first week or so with medical staff to determine if the initial dose was adequate or if it needed to be increased. Most of the time it does. We start generally a little bit low and work up over the first couple of weeks for some reasons that we'll talk about a little bit later. So the process of getting involved in treatment is very user-friendly. We do appreciate how challenging and difficult it is to walk through that front door and say, hey, I'm here for treatment of a very serious addiction. And so we want you to feel very much respected and appreciate the step and the difficulty in taking the step that you're taking.